So now we come to a speaker that leads us much more into the details of the whole problem. And I just want to present Christoph Wild. He is from Innsbruck. He's working at the Medical University of Innsbruck. And he is, he has collected a lot of experience in different fields of IT, be it in education, be it in communication, be it in design, and be it in projects. And of course, in the medical sector, there is an absolute need on debate on this whole issue. We had already a presentation in Innsbruck together with the university and a lot of representations on that, but I think he can lead us a little bit more into the details that will come with touching upon e-health problems. Thank you very much. Christoph, please.
Hello, okay. Thank you for inviting me, Eva. Today, the topic is data portability and privacy, and I'm going into the details on data collection using medical devices. So basically, there's a lot of devices nowadays in healthcare, but also in lifestyle products that collect a lot of medical data on persons. And these are several different devices. We have activity monitors, we have blood pressure monitors, we have even electronic Wi-Fi powered scales, we have sports watches, bike computers. All these devices collect medical data in a broader sense of the meaning. And even the lifestyle data is very, very valuable because it can show information on training patterns, how effective training patterns are, what changes on the physical variables with the body. So let's meet the ICD. The ICD is a little implant that you get if you have cardiac arrhythmia. It saves your life, basically, but it also collects a lot of data on itself and on the patient that gets it. So what it collects about itself is information on the battery life, the time it takes to deliver a life-saving shock to the patient if he has a cardiac arrest. But it also collects continuously data on the heart rhythm, the daily activity of the patient, can even measure chest wall impedance in order to see if there is a fluid buildup in the chest. And all this information is transmitted to the manufacturer of the device at the moment. So it's not going to the hospital or to the doctor or to the patient, but it goes to the manufacturer of the machine. Now, as I said, you have these lifestyle products. This is a Wi-Fi powered scale you see here. You have a blood pressure monitor. You have this activity monitor for the private person that measures how many steps you climb each day, how good you sleep, anything on you. And now, on the plus side, this is very positive effects for the patient. So, for example, if you, for clinical stable patients, doctors I talk to tell me that they can lower the frequency they have to visit the hospital to 6 to 12 months. In theory, you could lower the frequency for the visits to up to 2 years for persons coming back to the hospital for checkups. One of the problems in this regard is, or one of the problems, that several countries do not actually make these payable visits. In Germany, there seems to be legislation that has rates for virtual visits. In Austria, for example, doctors don't get paid if they remotely monitor their patients. If you take the information that the ICD collects about itself, so for example, the battery status, normally you have to calculate and think, okay, it's going to be empty around that time and we have to exchange the device. If you have remote monitoring, you can plan that up to 6 weeks in advance. So you know the last 6 weeks when the battery will finally be empty, which could be that you have to have just one exchange less over a patient's lifetime. That means more quality of life because one procedure the patient has to have less, and it also means that you can have to spend about 20,000 euros less on exchanging the device and the procedures around that. So it's a better quality of life. Now, the data that is collected, that's not just data, that's big data. So it's really a lot of data that's collected here. And only in the last years we've been able to process this data in a meaningful way. So when Nike, for example, started with Nike Plus several years ago, that they could measure the steps you take from jogging, that was just data going in, and they didn't have the means probably to process that. But nowadays, big data advancement in ICT enable companies and researchers to process this data. And some things I found on that is, so on the one hand side, there's evidence-based medicine, which is actually looking at data and raw data and lots of raw data, and basically big data could improve this a lot. There are estimates that by 2011, US healthcare organizations had generated about 150 exabytes, that's 150 billion gigabytes of data on patients. That's really a lot of data. And McKinsey and Company estimated 2011 that the US healthcare industry could potentially save about $200 billion if they used more advanced analytics on patients' data and healthcare data in order to see patterns for recalls and stuff like that. So there is really a large value for hospitals, doctors, researchers, and companies in there, but also for the individuals, I think. Now, as I said, at the moment, it looks something like this. You have these patients that have ICDs implanted, and the data currently gets, in a way, sent to the cloud. Sorry. Gets sent to the cloud, so to the company, and from there, it goes to the doctors. Now, the problem is that the doctors and the researchers just get some kind of management summary on the state the patient is in. So they don't get access to the raw, unprocessed data. They just get some nice graphics on that. They get some warnings out of it, but they don't have access to the raw data that actually is transmitted from the device to the company. Now, as I said before, the quality of life for the patients is raised by using remote monitoring. A second problematic thing about this is that the companies actually use the hospitals and the practitioners as some kind of proxy to get the consent forms signed by the patients in order to transmit the data. They know that they have to get the consent of the patient, but what they do is they say, okay, you have this device, and if you use remote monitoring, it's better for your patient, but if you want a better service, they have to sign that they transmit the data. So I think that's in a way problematic because when you sit in front of, as I said, I talked about the lifestyle products. There the data transmission is about being in the in crowd. It's cool, you share it with your friends, your colleagues, you can see who ran more miles last week. But if you sit down in front of the doctor and he tells you, okay, you got this heart disease and you need to get an implant, and if you want to have a better service, you have to sign that to transmit your data. You're not thinking about the implications of that or what several years down the road someone might do with your data. You're thinking about getting healthy again and getting the best medical care you can get at the moment. So I think this is a very problematic point. The second thing is that at the moment, this situation creates data silos. So every manufacturer has their own database system, and in regards to portability, I don't think if you change the ICD manufacturer from one company to the other, you can take the data with you and see all of the history. There isn't a standard on which data needs to be stored on that. There isn't a standard to port this data to another manufacturer. On the other hand side, a lot of interests are to get their hands on that data because it's for insurance companies, basically, or everyone else, it's very valuable, as I said. So for example, in Innsbruck, I'm told we have now the situation that they actually ordered a piece of software that's doing web scraping from the manufacturer's websites to get the raw data. So the software logs in using the credentials of the doctors, or it's planned to, it's going to be implemented, and then get the data from the system of the manufacturers and put it into the electronic health record system of the hospital. They had last year, it seems, a general agreement with one of the manufacturers, but that failed because of the proprietary formats in the health record system of the hospital and at the manufacturer. So even if both parties basically agree, okay, we could work something out, it still doesn't work because, or it fails because of the different formats. So the harmonization of information and especially the alarms which tell some about upcoming situations in the health are very important on that. Now, on the other hand side, or in addition, you have this e-patient movement. So you have really empowered, equipped, engaged and enabled persons, some of them doctors themselves, some of them researchers, or just people interested in their own condition that are very outspoken about that they want to have their own data and access to their own data. And not just, they don't even have access to the portals and management information I told you about for the doctors. They just get what the doctor tells them. So here we are at the point of the trust in the doctor and the trust in the system. And I think one of the key points in getting this under one head will be trust on the one hand side, strong regulation and legislation on the other hand side, but not forgetting about the rights of the patients. So they don't want to be just along for the ride anymore. They want to actively participate in what happens to them, I think. So you have the situation where the $149 Wi-Fi scale says you what you did last week, but the $30,000 ICD doesn't give you any data on you. Okay, so some questions in this regard. Now, who owns the data? I think everybody agrees the patient. So this is one thing. The second thing is who should access or who should have access to the data. I think the access needs to be strictly regulated. That's the thing that should stand in the beginning. So only opt-in, only with a very informed consent, but you have to discuss on that because if you consent to something now, you don't know what your data might tell about you 3 years down the road because of advances in research. And you certainly have to see, I think Guido will go on into this in more detail, not all patients are actually ready to be custodians of their own data. You see that in social media, how people behave there, and now you translate this into health records data. I think it's also important. And, but possible useful things could be medical device companies necessarily for post-market surveillance of the products they manufacture, scientists for research, doctors and hospitals for patient care, and the informed patients to know more about their condition and probably, for example, find out about triggers. So one of the patients said he found out about Scotch whiskey triggering his heart condition. The problem, I think, is that regulating bodies currently are left behind a bit by the technical innovation. So, for example, the FDA at the moment does not regulate the access to raw data and what happens to raw data. I think that's an omission in general. So the FDA should talk about that. Last year, the Government Accountability Office also released a paper that holds FDA or says that the FDA should increase their efforts on information security for medical devices. So also this aspect of medical devices is something that is not currently as much in the focus as it probably should be. So malware threats, patch vulnerability management for the devices should be raised. I think you can find a lot of articles on that. There was one case in Australia where someone hacked a pacemaker to deliver killing shocks, actually, and one researcher who wears an insulin pump himself was able to hack the device to raise and lower his insulin level at will. The only access codes he needed was the serial number of the device in the end. So this is not the security we would like to see there, I think. I think that the amendment to the AFAMED or brought into Article 18 in regard to that the person shall have the right that they get a copy of their own personal data if it is processed is very much in alignment with the thing the e-patients want to have. So I think this is very positive in this regard. So to come to some closing notes, what I think personally what we need. On the one hand side, I think we need to discuss whether we want to have the collection, storage and pre-processing of raw data from medical devices in the hand of the manufacturers. I think this is one of the questions we have to raise. There are several approaches. You can discuss on that. In the end, I personally believe that we should try to create some kind of an open data approach to raw data from medical devices. It's very difficult to achieve, I know that, and I'm not naive on that, but I think that if the research is for example, publicly co-founded by the EU, for example, I think that the data should be somehow in the correct way and under legislation and regulation be accessible for other publicly founded research. I think we need more open standards. So HL7, which is floating around in this regard, isn't an open standard. It's very bloated. It's expensive to implement. And I think that for some of the things, it should be perhaps an idea to create a W3C community that creates an open standardized standard like an XML derivate. I think there are a lot of ideas on that, and the Free Software Foundation, I think, is much more competent to give ideas on that. I think we also need common standards, and this is something you mentioned before, on anonymization, pseudonymization, so that all over the countries we have the same standards and what happens is exactly the same. And I also think that data privacy should be a much more important part in curricula for educating doctors. So I think this is something which at the moment is done if the university deems it important, but I think this is something that really should go into the curricula because it's not only about the computers, it's also about paper copies of health records and other stuff. So I think this is very important and actually in all age groups to talk about data privacy. And then in a way, we also should think about guidelines for intellectual property that come from, in regard to inventions that come out of this open data approach. Yeah. So a lot of questions. Thank you very much.
Thank you very much.